your Achilles tendon hurts. It can hurt when you run, it can hurt after you run, it can hurt the next day when you get out of bed, and it definitely hurts like a when you press on it. So you've looked up some exercises like stretches and heel drops, and you're going nuts because you're doing so many heel drops and it's not working. Well, cheer up. I might have something for you. Maybe not. Let's find out. The heel drops are the most recommended exercise for Achilles tendinopathy or tendonitis, including on my channel, link in the description. And it's a great exercise when prescribed for the right purpose, but it can make things worse under those conditions. The Achilles tendon runs from the calf muscle down all the way to the heel. And because it's a tendon, almost broke my guitar. So because it's a tendon, you can imagine it as a thick rubber band. And when you're putting your body weight onto your foot, let's say when you're lifting the heel off the floor, then you're loading the tendon, which means you're putting tension on it. That's a foot, that's the Achilles tendon attached to the calf. When you're putting load in that Achilles tendon, if you move the foot upwards, you can see that the heel is starting to slowly poke into that Achilles tendon, this bit right there. So if your pain is right at the bottom of the Achilles where it inserts into the heel, just there, I want you to realize that every time your heel drop, you're actually dorsiflexing. So you're presenting the tip of that heel to the tendon and you're poking into it. That repetitive motion can make your injury worse. Don't forget that a healthcare professional can examine you and confirm whether or not you're suffering from that injury. There is normally a little sachet of fluid that sits here between the tendon and the bone to prevent that kind of friction, that kind of poking. And under normal condition, the Achilles tendon and the bursa are both able to cope with that kind of poking mechanism. But if you've increased your mileage recently, if you started to work on uphills, if you change your footwear to something that's a little bit more minimal, basically suddenly introducing change into your running, this is when the Achilles might tire out because of that constant poking. Especially if you have an outgrowth or a spur on that heel bone, that's called a Haglund deformity. Or if it's not the Achilles, it might be the bursa itself that's tiring out. We call that bursitis. But enough talking, let's see what you can do about this. 3 things. First thing, relative rest, which means perhaps stop walking barefoot at home, wear your shoes, something that's got enough height at the heel compared to the front of the foot. If you lift the heel up, the tendon will become a little bit more loose. So you'd benefit from anything that lifts the heel. It could be putting some inserts into your shoe as well. One thing you don't want to do is stretch. Stretch will put your foot in that dorsiflexion. It'll poke into the tendon. In general, avoid dorsiflexion. Number 2, isometric holds. So you're going to lift your heel just above the floor at an angle where it doesn't hurt, and you're going to hold that for 30 seconds. The closer to the floor, the better. Repeat that 5 to 10 times the first couple of weeks. Number 2.5, because I realize there's actually a 4th tip, but I can't count. Massage gun. Take a tip that's not too aggressive and massage along the tendon, not over the tendon where it hurts. The mechanical vibration on the tissues around the tendon are enough to normally create a release. Don't massage gun on the bone, don't massage gun directly on the tendon. You're kind of gliding on either side of it. Number 3, return to exercise progressively. Start from scratch by first bouncing off that Achilles tendon like this. You're not jumping, you're not hopping, not yet. You're just getting that Achilles tendon more responsive to impact, just to prepare the tendon for running. If that increases the pain or it hurts more the next day, you're not ready to go out running yet. So continue the exercises until it gets better. Be patient, build up the strength. We're looking into a few months of retraining.
What?
Yep. A few months. But as I always say, that downtime is not wasted time. It's the opportunity for you to work on yourself, work on your weaker muscles, look if you've got imbalances, work on your glutes, work on your core, focus on your weaknesses. If you take ownership of that time, you might end up even stronger than before the injury, because you will have worked on areas that you would not have considered had you not gotten injured. For Achilles tendonitis, also always consider the strength of the foot. I've got some great videos about foot strength, some videos about glute exercises. Just browse around the channel and hopefully you'll find something interesting and well suited. I'll see you there, and in the meantime, à bientôt.